There are several key imaging markers that we use in imaging to identify and to stratify vascular cognitive impairment. We usually take a look to white matter hyperintensities, the most useful marker and the most used marker, bright spots that we can see on T2-weighted and FLIR images on MRI that are suggestive of chronic small vessel ischemia. And also white matter hyperintensities are associated with increased risk of stroke, also dementia, and are a significant marker of VCI. Then we are noted that there's a lot of interest on cerebral microbleeds. These are small, round, hypointense signal lesions seen especially on the gradient echo or especially on susceptibility-weighted MRI sequences that are indicative of all the small vessel hemorrhages, and their presence can be a sign of cerebral small vessel disease and a significant risk factor for vascular cognitive impairment. More going from the hyperintensity to the shape, we always have to take a look to cerebral atrophy, that a volume loss of a generalized brain or regional volume loss can be associated with vascular cognitive impairment. And also we have to take a look to infarcts that can be symptomatic and or asymptomatic, strategic or non-strategic, and can contribute to cognitive decline. And also staying on the same side, lacunes, small cavities in the brain as after a deep infarct, also are associated with vascular cognitive impairment. And finally, we have to take a look also to enlarged perivascular spaces that can contribute to vascular cognitive impairment. But more that these single factors, the most important thing is to evaluate the global burden of all these single findings. So we can also have some infarcts, not so good cerebral atrophy, no cerebral microbleeds, but we have a lot of white matter hyperintensity. The sum is crucial in the diagnosis of vascular cognitive impairment. And also we can do as a neuroradiologist imaging we can find these findings, but the clinical correlation is crucial as always.